We hear a lot if somebody has bipolar disorder to avoid your traditional antidepressants like SSRIs, SNRIs, tricyclic antidepressants, anything serotonergic in nature. So what about stimulants? Generally speaking, stimulants are first line with ADHD or attention deficit, but if the person has bipolar disorder, we have to consider other options, and here's why. Amphetamines are one of the animal models or causes of mania and psychosis. So amphetamines specifically increase the risk of mania in bipolar disorder by 7 times, and then the psychosis risk by 2 times. For this reason, we try and avoid stimulants. Again, generally speaking, in bipolar disorder, you wouldn't prescribe a pro-cancer drug to somebody who has cancer, because that's basically what you're doing whenever you are giving somebody a stimulant, specifically, especially, I guess I should say, the amphetamine class. So arguably, since the methylphenidate class isn't quite as potent, that could be an option. Other options would be things like the alpha agonists, so like clonidine, guanfacine, both FDA approved specifically in kids for ADHD. Also, armodafinil has some good evidence for it. Also, lithium, if the person's on lithium and has bipolar disorder, there are several studies that show that lithium can reverse the neurotoxicity that stimulants can cause. 30% of my patients are on the bipolar spectrum, so I see this a lot where a past provider maybe has mistaken ADHD for bipolar, bipolar for ADHD, vice versa, or the patients that truly do have both ADHD and bipolar, they are on an amphetamine product. I have had long conversations with these patients. They are many, I guess I should say, are very convinced that the Adderall is what, or the Vyvanse or Dexedrine or whatever amphetamine class that they're on is what helps them function. We have a long conversation about it. I can tell you anecdotally that I've had patients switch to things like guanfacine, clonidine, lower doses of the methylphenidate, so like Ritalin, or Concerta, or armodafinil even, and they have done excellent.